Here we can see the importance of the multidisciplinary evaluations of in patients with SMA. As we know, SMA is a chronic disease with a progressive weakness, and it can affect different organs or systems. Here we have the main abnormalities, complications that we can see in a patient with SMA. So to take care of these patients, we need a multidisciplinary team. And this multidisciplinary team include a pediatrician, a pediatric neurologist or neurologist, a pneumologist, orthopedist, also physiotherapist, occupational therapist, speech therapist, and also geneticist and psychologist. So it's a huge team, and this team needs to work together, and they need a coordinator. So the professionals need to talk about the patients and to decide the best intervention in each stage of the disease. So considering the main complications here, we can see at the gastrointestinal tract, we can see the dysfunction of feeding. Some patients will have dysphagia, and we have to take care very early about this to avoid nutritional disorders. Also, we can have constipation, and it needs to be treated. Considering the respiratory involvement, it's very important to remember that these patients has respiratory muscle weakness, and it's important to manage and to monitor and to manage these patients. Here we have to organize some exams, and in infants it's very important to have the polysonogram, because it will give us information about the oxygenation and also data from capnography. For our kids that are older, we can use the spirometry, and we will have the vital capacity that also will be very important to give us information about the necessity of ventilatory support. Neurologist will manage these exams, and also he needs to be present when these patients has acute respiratory infections. The orthopedist is very important also. He needs to monitor the spine, also the hip, and also joint contractures. He needs to work together with a physiotherapy, and this physiotherapy is very important that this professional is used to do the rehabilitation in neuromuscular disorders. And also it's very important that he knows how to use the motor function scales. Also here, the occupational therapist is very important to do some adaptations in the furniture at home and also at the school, and also the adaptations in the wheelchair. Other professionals that I said before, the genetic counselor or geneticists are very important to give information about the disease for the families, and also to do the genetic counseling. And also the psychologist, that is a very important professional to give support for the family, also the patients, and also for the team. Another important thing that I would like to highlight is patients that are using the new drugs needs to be followed by the multidisciplinary team. So the combination of the new drugs with the rehabilitation will bring better results for the patient.